So I think I've talked to like at least 50% of people here already today. But I'll just briefly kind of introduce myself and my background. Um, and so the first part of the session, hopefully I'll keep you all awake, will be a bit of a background on human behavior change frameworks, why we should use them, why they're important. And then we're going to be doing a little bit of a session where we're going to get you to develop your own intervention. So it's like 16 pages worth of a document. I can circulate it after this if you want to actually use it and practice yourself, but we'll just do a kind of quick run through of it today. So if you want to do it on an individual basis or in small groups, I'll just put the worksheet up. I will go through some of the stages of behavior change intervention creation. But then you can obviously spend time doing it at home if it's something that you're interested in. So I carry out my research at the Animal Behaviour Centre, which is within the School of Psychology at Queen's University, Belfast. So as with a lot of animal welfare scientists, some of you are probably the same, you're kind of shoehorned into a different department. So some people are in the veterinary department, some are in the ag science department. I'm in the psychology department. So there are two of us in psychology, and we're kind of the outsiders. So it's mostly clinical psychologists, health psychologists, social psychologists, and then there's us. There's also other animal behavior and welfare researchers in the biological sciences school. So we're kind of split across different areas, but it actually has been useful to be in the School of Psychology, in kind of learning like what are they doing well and how do we need to catch up as a discipline when it comes to the human behavior. So my background is kind of mixed. So my BSc was in psychology. It was actually in psychology applied to IT. So I have a bit of computery stuff in there as well. Then I did my master's in animal behavior and welfare. And I did my PhD in pig welfare. So it was about what can you tell from the carcass of the pig about the lifetime welfare. And then I started lecturing at Hartpury University in England, and it was anthrozoology, so human animal interactions, animal behavior, animal welfare. Taught a few kind of agricultural science, animal science classes. And then I worked for Moy Park in Northern Ireland, which is the chicken company. So got to see lots of chickens at the different stages of production. And then I started working at Queen's permanently in 2018. And yeah, in the psychology department, as I said, and I was starting to think about, you know, oh, I could actually maybe utilize some of the techniques that I've learned within psychology and apply them to animal behavior and welfare. So I attended a lot of kind of lunchtime seminars, and most of our department have health psychologists. So there's maybe 8 or 9, probably even more now, lecturers or clinical psychologists and health psychologists. And I went to a lot of talks by them and by people that they'd invited from different universities. And a lot of what they were talking about was how to change things like, you know, to get people to stop smoking, to get people to lose weight. In the field of kind of human health, it was, you know, getting people to adhere to their medication, getting doctors to give certain types of advice and stuff like that. And I was thinking about, you know, looking at, let's just say, you know, consumer attitudes and intentions to purchase high welfare food. And one of my colleagues was like, oh, the theory of planned behavior, so like, you know, 10 years ago. And I was like, all right, well, everybody uses this. Like in psychology, we look at, does someone have a positive attitude towards something or a negative attitude towards something? Do they intend to do something or do they intend to not do it? And that's what a lot of us will kind of carry out research when we look at humans. It's attitudes and intentions. Where actually, when I talked to the health psychologists, they were like, that's just one small component. So they do influence our behavior, but health psychology is moving towards kind of overarching frameworks of behavior change that look at things that are internal to us, so our motivations, what we care about, but also look at things that are external. So do I have the funding? Do I have the time? Am I able to carry out behavior that I want to carry out? So it looks at that as one part of a broader range of kind of criteria that make people behave in certain ways. So then I started being like, okay, right, I don't want to be behind on the time. So I'll start looking into these different frameworks. And the main ones that I started looking at are the behavior change wheel, the theoretical domains framework, and the behavior change technique taxonomy. I'll just give you a broad overview of each one and basically why they're useful and how you should kind of use them. But I think it is interesting what a few other people have said today already. It's ideally you want to get people that are experts in behavior change, which is usually health psychologists, to help you when you're designing an intervention. But why is it important to develop an intervention in the first place is, well, if you kind of think about animal welfare science in general, we've done a lot of research. There are things like, let's say, tail biting in pigs. We know what causes it. We know what we should probably do to avoid tail biting, but nothing's really changed. So I remember reviewing the literature and I was like, oh, 60 years, 1960s, they were saying tail biting is caused by a lack of enrichment. You should put straw in the pens. Nothing's changed in Ireland anyway. Maybe other countries are a bit better than us. But Northern Ireland and the Republic of Ireland are very similar in how they farm pigs, but nothing's actually changed. And that's because sometimes we know what we should do to improve welfare, but it's actually getting the humans to do what we want them to do, or to stop doing something they shouldn't be doing. So there's more of a focus now, I think, moving forward in the next few years on how do we get people to implement the changes that we want? How do we get them to adhere to a certain law, to carry out a certain management technique, to not carry out a certain management technique? And this is why these frameworks are good, in collaboration with usually a health psychologist, to actually help you, understand the behavior that you want to change and how you then actually change it. So I've worked with a few people. I worked with a few health psychologists, but it's interesting, some of the questions that were asked earlier on were people that you collaborate with. Were they getting paid to do the job, or were they willing participants? Sometimes I do find when you're working with people that are health psychologists and their interest is like, human health, human diseases, human medical conditions, they'll help you, but they don't particularly want to be on a pig paper because it's a bit weird looking, if someone looks at their career and where they're going. But I have found there's at least one person who she's actually kind of a mirror image of me in a way, the opposite. So she did health psychology, clinical psychology, and now she's working in animal health and welfare. So she's a clinical psychologist that was trained in these techniques, and now she's actively working in animal behavior, animal welfare, and for animal health. So she actually is interested in this. So it's once you find people that are interested in the behavior change aspect and in the animal aspect as well, because sometimes I do find it's like, yeah, people can help, but it might not benefit them particularly or their career interests. So I think it's about finding, what works for both. So yeah, why use these methods from psychology? So yeah, there are loads of examples. You can probably think of them yourselves where solutions were developed that are never implemented because it just didn't work in practice. And I think, people were talking about, the need to actively involve stakeholders at the beginning. So that's what I'm trying to do kind of moving forward with every project I'm on, is to actively involve, especially people like farmers, because they'll say time and time again, how would you know you're not a farmer? How would the government know they're not a farmer? One problem with using the theory of planned behavior, which is, attitudes predict intentions, which predict behavior, is what's known as the behavior intention gap, which I'm sure some of you have heard of, where the things that people say they do, they don't actually do. One of the most common examples of this would be consumers. Will you pay extra for high welfare sausages? Yes, I will. If they actually go into a shop and they see a cheaper packet of sausages and a more expensive one, they pick the cheaper option. So there is a gap in what people say they do and what they actually do. And that's why people are moving on, especially health psychologists are moving on from this theory of planned behavior to a more comprehensive overview of the problems that are impacting people's ability to implement animal welfare changes. So the good thing about these overarching frameworks is that it's both intrinsic and extrinsic determinants of behavior are considered. So again, not that I care about welfare, I'm motivated, but it's also looking at what are the extrinsic external factors. So government legislation makes it difficult. I don't have the type of housing that's needed to provide enrichment. So it's looking at internal factors to the person and external factors in the environment. So it's a comprehensive overview of what's stopping us from doing what we should be doing for animal welfare. And we also have what's called, as I said, the behavior change technique taxonomy. And that allows you to specify the active ingredients of an intervention. So I don't know if any of you have carried out an intervention study, but when you look at a lot of them, it's, okay, we'll run an information session for one group of farmers, let's say, and for the other, we won't. But you need to give certain amount of details for that to be, be able to be repeated by somebody else, and to actually, if it does work, brilliant. What was it that actually worked? Like, what was the thing that actually worked? So the behavior change technique taxonomy allows you to map the different interventions to its active ingredients. So this is kind of skipping forward to the last stage of intervention design, but I just thought I'd put it up as an example. So I have a PhD student that will be starting on this study in October. But this is just the kind of ideas for interventions to reduce tail biting. So what I want to do is see if we give, so let's just say in Ireland, very intensive, 99.9% of pigs are reared indoors, slatted floors, so they can't provide much enrichment. So I want to see, well, how can I get people to reduce their tail lesions? So if I give people information on their prevalence, will that be enough? If I give them benchmark prevalence, you're in the bottom 5%, you've got way more tail lesions than everybody else. Would that be a motivator to actually get them to reduce their tail lesion prevalence? But you have to be careful that you don't accidentally give an intervention to the control group, for example. And this is why mapping your intervention is really important. So in this hypothetical study that hasn't started yet, I would go to the abattoir and monitor tail lesions in pigs. So I don't need a farmer's permission. It's already gone to the abattoir. The pigs have gone to the abattoir. They belong to the abattoir for all intents and purposes while they're being slaughtered. So I can monitor that farmer's tail lesions. I can get the SLAP number off the pig. The farmer doesn't need to know anything about it. But a lot of the time, if you go into two different farms, the first farm, you just do an inspection and you maybe don't give them feedback on what was good or bad. That's still an intervention in itself, because monitoring, somebody knowing that they're being monitored, changes their behavior. So that's why if it's a true control, which it would be in my case, they don't know anything about the study, then there's no behavior change technique. But if you're monitoring someone and not giving them any feedback or not doing anything else, that's classified as a behavior change technique. And there is evidence from human psychology to suggest that only monitoring, just being monitored, that's still going to change your behavior. So there's two, let's say, active ingredients of that type of intervention. They know they're being monitored, if they do know they're being monitored, and they're also getting their tail lesion prevalence. Then you could have another group, they're being monitored, they're getting their tail lesion prevalence, and it's benchmarked. So that's three separate interventions. And then you can break your groups up. You can have a control, you can have a monitor only, tail lesion prevalence, and monitor tail lesion or benchmark tail lesion prevalence. If you divide them up, you can tease out what is actually the active ingredient, what worked or what didn't work. So this is useful kind of moving forward with animal behavior change interventions. So I'll briefly introduce these concepts. I'll provide my contact information at the end as well. I don't want to give you like too much information, but if you're interested in any type of behavior change intervention, let me know. The good thing about this is once you know it, once you know how to do it, and you have maybe one or two collaborators, you can look at any topic with any species. So I started working, I've worked with pigs. I'm now working with small mammals, horses, loads of different challenges can be addressed with these techniques. So I'll just briefly introduce you to the behavior change wheel, theoretical domains framework, and the behavior change technique taxonomy. Can you just put your hands up if you are any way familiar with these frameworks? No, completely new? Well, yeah, okay. So I would say have a look. So it's Susan Michie, Michie, et al. They have created all this. She's a health psychologist. And the good thing about the behavior change wheel, there's an online ebook and it's really easy to read. It's been designed to be, you can train yourself to do it basically. So you could have a look at that, come up with some ideas, and then, if you can find a psychologist or whatever to collaborate with, it can just address lots of different issues. So I'll then put the worksheet up at the end. We can kind of get started with an intervention design. And then you can take them home with you if you do want to look at them in the future, if there's something of relevance to your research. So the first step is understanding the behavior. So what behavior do you actually want to change? Sometimes you might not know what behavior you want to change yet. So I'm working on a project at the minute, and it's looking at the barriers to the adoption of higher welfare or alternative kind of farming systems in Ireland. have a specific behavior I want to change. It could be a behavior or it could be an outcome. So you might have a broad idea or you might have a specific idea. I want to change this behavior. I want to stop people tail docking pigs. That's a clear kind of outcome, or sorry, behavior. So what specific behavior do you want to change? What's the desired outcome? So if we look at tail biting in pigs as an example, like what's the difference between an outcome and a behavior? A behavior would be, I want farmers to add enrichment to the pen 2 times a day, every day. And an outcome would be, I want to see a reduction in tail lesions. So for me, if I'm interested in tail lesions, there's so many ways that we can do it. We can add enrichment. It might be something to do with the temperature, the stocking density. So if I'm interested in the outcome, I want to see, well, will tail lesions reduce? And it's important to always kind of measure the behavior and measure the outcome, because if the outcome doesn't change, then the intervention didn't really work. So I want you to start thinking about a behavior in humans that you would like to change based on your own research, based on your own kind of area of interest. We can use some of those examples when we go through the activity. So thinking about the target behavior. The behaviors occur within the context of other behaviors. So, if I want a farmer to start adding straw or to chop straw, that's going to take away time that he has to do other activities. Think about all relevant behaviors and create a list of potential behaviors to target. So you might say, this is the one behavior I really want to change. I want people to start doing it, stop doing it, do it at a different frequency than it's currently being done. And then you prioritize your behavior. So you consider how modifiable the behavior is likely to be. So is it physically possible for them to do it? Is it something that's easier, something that's more difficult? How important is the behavior in bringing about the change in the desired outcome? How does the change in the target behavior affect related behaviors? And how easy is the target behavior to measure? So this is a common problem when we're designing interventions. We do an intervention, an education intervention, for example. We don't actually measure in an easy to kind of record way how the behavior was changed. So if we ask people, did you do this, yes or no, that's good enough, but it'd be even better if you had some way of concretely measuring the target behavior. So what needs to change? So specify the behavior in appropriate detail and in its context. So the more precise, the better. So for example, I want people to walk their dogs more often. It's kind of broad. I want people to bring their dogs on 2 20-minute walks every single day. That's a more specific behavior. And then looking at the behavior in terms of who needs to perform the behavior, what does the person need to do differently to achieve the change? When will they do it? Where will they do it? How often will they do it? With whom will they do it? So they might be doing something on their own, they might be doing something with their family. How often? I just said, twice a day. Where? It could be, on the farm, it could be at home, it depends on the context. So the more specific you are on what you want them to do, the better you can target that and actually try and make it happen. So one common framework that I would use is the COM-B. So I don't know if you've come across this, but it's basically like means, motive, opportunity to murder somebody. That's where the concept came from. So you will engage in a behavior if you have the capability to do it. So if you're able to do it, that could be physical capability or psychological capability. The opportunity, have you got the chance to do it? So it could be, again, physical opportunity. My house is too small. I can't, have an L-shaped sofa in it. Or so social opportunity and physical opportunity. Social opportunity, none of my friends are doing this behavior, so I'm not going to do it. And then you have motivation. So reflective motivation and automatic motivation. So automatic motivation would be things like habit. So I'm just in the habit of doing something. Reflective is more like what you care about. I care about animal welfare, so I'm going to make a change. And these three things, capability, opportunity, motivation, interact with each other, and it influences behavior. And it's a nice kind of easy framework to use to understand why we do the things we do, or to how to get us to do the things that we should be doing for animal welfare. Underneath this is the theoretical domains framework. So some people use this when they're designing behavior change interventions, and some people don't. So the COM-B is probably the best, most simplistic. It's the overarching kind of structure. And then underneath it, we have the theoretical domains framework. So you can see here how it kind of fits. In the yellow, you've got the domains, and then in green, you've got the COM-B. So for example, if we look at, let's say, psychological capability, underneath this, there's even more specific subset of things that meet that criteria that are known to influence behavior. So we have knowledge, we have memory, attention, and decision-making processes. We have behavioral regulation. And cognitive and interpersonal skills. So, you know, if something is an issue in terms of psychological capability, it could be you don't have the skills to do it. You don't have the knowledge. Similarly, if we go to physical opportunity, it's about the environmental context. So is it the space, is it the availability of things, physical structures in the environment? So basically, this is like the COM-B, but it gets even more specific. So it's 14 domains that sit under that COM-B. So some of them here as an example: knowledge, skills, memory, behavioral regulation, optimism. So basically, the starting point, if I'm developing an intervention, I need to know what are the barriers or facilitators in relation to the behavior. So if I want to look at, you know, why are indoor pig farmers, or, you know, why don't they have high welfare systems? I'll create a questionnaire. It could be an interview schedule. It could be a focus group schedule. And I will try and map questions to as many of these domains as I possibly can, because these are based on previous research, are known to influence behavior. So knowledge, I might say, well, what do you know about high welfare outdoor systems? Skills, it might be, you know, do you know what skills you would need to be able to perform your daily tasks in an outdoor pig farm? You could look at optimism. If they're like, there's no point, it's a waste of time, that's pessimistic, so they're less likely to actually engage in the behavior. You can also look at social influences. So, you know, if they're like, yeah, a lot of farmers are actually interested in this, then they're more likely to be interested in it as well. So it basically gives you a nice framework for like, what type of questions should I ask in this questionnaire, in this survey, in this interview, or in this focus group? And then this nicely links to appropriate interventions. So there are certain types of interventions that are known to work if there's a lack of knowledge. There's certain interventions that are known to work if there's negative social influences. So you can use the behavior change wheel. So the COM-B, capability, opportunity, motivation, is in the center, and you can use that to design an intervention based on the barriers that you've identified using the COM-B or the theoretical domains framework. So the nice thing is they all fit together. So you've got a guide. It might be, no, they've got the knowledge, they've got the skills, they just have no intention and they believe it won't be profitable. That links then to specific types of interventions that might work. So for example, the easy option would be, we will give you a financial incentive or a subsidy. So you've identified the behavior, and you then want to identify the intervention options. So this is, intervention function. So this is different ways you can deliver an intervention. So again, at the minute, when we look at animal welfare science, we tend to focus on education. But depressingly, a lot of research suggests that education doesn't work, or it works short term and not long term. So if we're developing kind of an educational tool and we deliver it once and maybe measure people's attitudes at, you know, a month later, it's short term, so we don't know if it worked long term, and we don't really know if they changed their behavior or if they just, you know, felt more positive about something but didn't actually do it. So education is one important one, and it depends on the context, but it's not the only one. So we can use different methods. We can use persuasion, we can use incentivization. So again, this would be a lot with farming. You know, I think in some countries they have kind of more welfare related subsidies, whereas in Ireland they don't. And this might incentivize them if they did have it. Coercion. So this would be, we're banning this, or you're going to get a fine if you do that, you know. So this is obviously the one that farmers don't like. So we're trying to move away from coercive type of techniques. Things like training, restriction, Environmental restructuring. So, if you change an environment, it can enable or make a behavior easier to carry out or more difficult to carry out. Modeling as well, and enablement. So it's a nice framework. Again, these link to the barriers that you have identified. So you can see here, you've got capability, opportunity, motivation. You've got the two types of each of those, which I've talked about. And then that second layer, the intervention function. So strategies which evidence suggests, this is all evidence-based, are useful in targeting particular mechanisms of action. So previous research has suggested that they actually work in targeting capability, opportunity, and motivation in order to change a particular behavior. And then we've got the outermost layer, which is the policy categories. So this is, how do I actually implement this? Again, you can kind of see, you can kind of tell here that it's from health psychology, which would be, linked, governments would want people to get people to adhere to a certain policy or whatever, but it's definitely applicable to animal welfare contexts as well. So we've got different policy categories. So what you're going to generally, what type of intervention you're going to have, might be education, for example. Then you might, use communication or marketing. So you might have, ads on, to warn against dangerous driving. You could have guidelines. So you could create a set of guidelines for what people should do. You could have fiscal measures, which is around money. You might tax something. You might, reduce tax on something. Regulation and legislation, environmental or social planning, or service provision. So we could just say we're changing the legislation. This is illegal now. So in Ireland, I think it was 2004, the smoking ban came in, and that's it. It's law now. Nobody thought it would be followed, but it was. So that's one method. You might ban something. That's another method. You might market, or you might communicate the benefits of something, and that might work. When it comes to farmers that want to try new techniques, but they're not that familiar with it, sometimes I think something like service provision can be useful. So they want to know how something's possible, so you can train them how to do that. So it's a higher level of how are you going to implement this kind of intervention. So you can see that there, that's in the outermost layer. So it's the highest level. So policy related changes that may need to be considered to support the implementation or the maintenance of the behavior change technique. So we've got those three layers, shall we say, and they all link to each other. So let's say if something is an issue of psychological capability, it will say, okay, education might work, persuasion might work, coercion won't work. So it has a list in the behavior change technique book, the behavior change wheel, of for education, these four options might work. If it's an issue of physical opportunity, these solutions will work. So it all links together. And there's some interesting kind of useful criteria that you would always use, and you can use these at several stages of the process, called the APPEASE criteria. And it's, aside from what are the barriers, how do they link to an appropriate intervention, it also takes external factors into account. So it stands for affordability. So I would love to say to farmers, look, the government, based on my research, they're going to give you £20 million each and you can build a new house. So that's how you're going to have enrichment. You're just going to build a completely new house with more space, with a concrete area, slatted area, and it'll all be fine. It's not realistic. So affordability, practicability. So how practical is it? Is this something farmers can actually do? And I'm using the example of farmers, but even pet owners. Is something affordable for the pet owner? Is it practical for them to do? How effective is it going to be? Is it really going to get the end result that you want? And is it cost effective, which is always important? Also, acceptability. So is it something that's going to be socially acceptable? If not, you might find there's a roadblock there. Side effects and safety. So obviously there should be something that's safe. And equity. So does it hamper equality or equity in any way? So these criteria, you can go back to these after the first phase of intervention design, the second phase, and it's good to keep these in your mind because it reminds you kind of what's realistic. And then you have step 3, you identify your intervention content and implementation options. So what is, it might be, right, I'm going to do an educational intervention, but what does that actually look like? Again, that's something that we tend to fall a bit short on sometimes. We might say, an informative session on the benefits of not docking pigs' tails was given, and that might be it. the people need to know what was in it, who delivered it, you know, what was the content, how did you assess it at the end. So, sorry, that's gone back way there. So a behavior change technique, there's actually an app you can download, which I find is really useful. It's called the Behavior Change Technique Taxonomy, BCTT. And you can actually search for different types of interventions. So it's actually useful that it's in an app. But behavior change techniques are what I talked about at the beginning there. So an active component of an intervention that's designed to change behavior. So telling someone they're going to be observed, actually observing them, all these different things are interventions. And there's 93 behavior change techniques, and it's basically designed to be as comprehensive as possible. So any possible intervention you could think of should be technically there under those 93 headings. This is where you would consult with a health psychologist that's actually familiar with these, because it gets a bit, you know, information overloading. So they're observable, they're replicable, and they're an irreducible component of an intervention. So if somebody reads your paper on your intervention and it's as detailed as it should be, they should know what worked and why it did or didn't work, which aspect of the intervention worked, and they should be able to replicate it. So it can be used alone or in combination with other behavior change techniques. So I'm looking at, well, I'll tell people they're being observed. I'll monitor their tail lesions. I'll give them benchmark prevalence. I'll just give them prevalence on its own. So it can have several components, but as long as you specify, this is one, you know, I'm using, let's just say, if you tell people, I'm going to give you a reward, telling them they're going to get a reward is an intervention, and actually getting the reward is an intervention, because people thinking they're getting a reward is an intervention in itself, even if you didn't at the end. So, you know, it breaks everything down and makes sure that, you know, everything that could possibly influence the outcome is accounted for. And it was organized into 16 different groups to make it easier to kind of manage by a group of psychologists. And you should be guided by the definition and not by the label. So that's why you need to actually go into all these different interventions and see what they actually are about. So this is one part where I would say to consult with a health psychologist with some experience in this. So these are the 16 broad categories. So we've got goals and planning. So if you're weight loss, for example, you set your weight loss goal on a monthly basis and plan what you're going to eat every day. That's an intervention. Feedback and monitoring. That will be what I was talking about with the farmers. I'm monitoring their tail lesions and I'm giving them feedback. There's social support. So for different problems, there'll be different solutions. Shaping knowledge, natural consequences, comparison of behavior. That's where the benchmark prevalence would be. Well, you've got really high prevalence of tail lesions and this farm's got really low. So you can have a mixture. And then we have things like threat and rewards. There can be incentives, there could be monetary rewards, there could be social rewards. You know, there's all these different things that, again, all of these 93 behavior change techniques link back to the behavior change wheel. So I identified it's an issue of psychological capability. This is the best way to deliver the intervention, and this is the best behavior change technique for this type of barrier to achieving the desired behavior. So it's just nice and neat the way it kind of takes all of these frameworks of behavior change or different theories of behavior change and fits everything together in a kind of easy to understand format. You can see on the right hand side there's just a picture of the app. So that's just a screenshot from my phone. And you might think, okay, it's an issue of psychological capability, so I need to do an intervention related to education. Click education and it'll show you all the different ideas for that. It might be the farmers want to do this, but they don't know how. Right, that links to modeling of behavior. I'll go in there and I'll see what fits under that. So it's really useful for mapping everything. So the first step is to consider all the behavior change techniques that could be considered for a particular issue, and then narrow the long list of behavior change techniques down to the ones that are most likely to be appropriate to that given situation. Then also, again, considering the APEAS criteria or the behavior change techniques used most frequently for your chosen intervention. So you'll have a list for education. People frequently use this one or that one. But again, where it all is in the context of your specific issue. So that's where the APEAS criteria come in again. Is it realistic? Is it cost effective, etc.? Mode of delivery is also important. So often an insufficient distinction is made between the intervention content and the mode of delivery. So often there's more detail on the mode of delivery. So we had a workshop, blah, 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 but we don't talk about the details. So what was the actual content? What was covered? How was it covered? So we can't really see it on how clearly you can see this here. This is an example of modes of delivery that are involved in communication as an intervention. So was it face-to-face? Was it distance, online? Was it individual or at group level? Was it broadcast media? Was this information delivered by television, radio, internet, digital media, etc.? So this is the mode of delivery. How it was delivered, and then what was delivered needs to be specified separately. And again, that's really important for being able to replicate. So the mode of delivery, the content, what exactly was delivered, as detailed as possible. Who delivered it? Was it one person, two? What was their background? Who was it? Where was it delivered? To whom was it delivered? The intensity, which is important. So over how many contacts was it delivered? Was it delivered once? Was it delivered once a month? The duration, so what period of time was it delivered for? And fidelity, the extent to which it was delivered as intended. So again, it's important to, say, well, this went wrong or that went wrong. This bit had to be left out due to time constraints or whatever. So it's being as specific as possible. And people can go back and say, well, that worked for them. Let's see if it works for us. And they'll know what worked and what didn't. So there's some further resources. So I'll have these slides available. Hopefully I'll get them sent around. And again, if you are interested, the Behaviour Change Wheel website in particular is quite easy to follow. But starting to fit these frameworks together now. And I'll talk a little bit just about my kind of research, and we'll do an activity, and hopefully it'll still be alive by the end. But it's just to get you started with this if it is something that you're interested in. So just to kind of fit together so far what we've talked about. So we've got the COMB, so COMB, so capability, opportunity, and motivation interact to influence behavior. And you can see the arrows going up and down from capability, opportunity, and motivation. And that's basically showing they all influence behavior, but they also influence each other. So if I increase someone's capability to do something, they might be then more motivated to do it. So they all interact together. Underneath this, then, you've got the theoretical domains framework. So for psychological capability, if we want to get down into the nitty gritty, it could be an issue of knowledge, it could be an issue of skills. It's going down just that bit more detail. And then when you've looked at that, you might use that to look at, well, what are the barriers? So, what do you know about this topic? Oh, they know a lot about it. It's not knowledge. So it lets you narrow down what are issues and what aren't issues in terms of capability, opportunity, and motivation. And then you've got the outer layers, the two outermost layers of the wheel, the intervention functions and the policy categories. So how is this going to be delivered? So psychological capability, okay, that's related to education, it's related to persuasion. What's the best way to implement education? It might be service provision, it might be communication and marketing. So you're looking at what needs to change, how will we deliver that change? And then you've got the behavior change technique taxonomy. So that's what is the active, or what are the active ingredients of the intervention. So again, it's a lot of kind of new terminology. The most important thing I think is to start off with, if you are interested in this topic, is the COMB, so the barriers, and then you go on then to create your interventions. And it is a long kind of road. So I'm on a few projects now where we're at the point where we're looking at what are the barriers to this behavior. And then once you've done that part via interview, we're doing interviews, focus groups, surveys, for example, then you start to design an intervention, and then you have to start delivering it, which is the more kind of complicated and time consuming aspect. So just to talk briefly about some uses in practice, and then I'll get you to give it a go maybe in small groups. So just 3 examples of how I'm using this in practice at the minute. So with one project, I'm working in collaboration with Hartbury University in England and the Blue Cross. And we're looking at barriers and facilitators in providing suitable housing for rabbits and small rodents. So we're looking at, you know, from what they've seen, people keep their companion animals, their small mammals, in enclosures that are too small. They don't give them enough environmental enrichment. So it's basically a state of play to see how much do people know about how their specific species should be kept. And then looking at what are the issues. Is it the capability to look after the animal, the opportunity, or the motivation? And so far, I haven't published it yet, but what's coming through really strongly is that it's opportunity. Because when they go to a pet shop, they're not able to buy an enclosure that's big enough because they don't sell them. So that's not them not being motivated. They might care, but if you can't buy the housing that you need in the shop, then you're less likely to provide it. Now, there are some people that are really motivated to make their own housing, but a big issue is if something's not available, it can't be, it can't be used. Same as if we literally got rid of all cigarettes in the world and you could not get your hands on them, then instantaneously everybody that smokes would no longer smoke because it's not physically possible. So for that problem, it does seem like it's opportunity. I'm also working on a project, One Well Pig. It's across Northern Ireland and the Republic of Ireland, looking at barriers and facilitators in uptake of alternative pig farming systems. So I talked about that a little bit already. But basically I had interviews and one focus group and let's say 10 or 12 interviews for alternative farmers. So anything that's not conventional. So a lot of them were outdoor farmers. And then the same amount of focus groups and interviews for indoor pig farmers, and looking at what are the struggles for people already doing outdoor pig farming and high welfare, and what are the barriers to people to not, in starting to do it. So basically what I came up with so far is that they've both got completely different sets of problems, and we probably need to treat them as two different groups completely. And it does seem to be opportunity as well. So lack of money, lack of space, lack of time, lack of skilled staff. Also, knowledge does come into it. So having the lack of staff that know how to look after the animals. So there was a bit of capability, a lot of lack of opportunity, and a little bit of lack of motivation. But it's really useful in saying, okay, it's opportunity. What do we need to do to make people able to have higher welfare systems? So it's just really good for like directing where your project needs to go. And then the last project, I'll just give you as an example, is the Pigtail project. Original title, but it's on pigtails. And looking at the tail docking ban in Ireland. So, it's illegal to routinely tail dock, but everybody does it. So it's looking at, why do you not follow the law? Why do you follow the law? Nobody does. So again, it's probably what they're going to say is, well, we have the housing that we have. We can't have straw because it blocks the sewage systems. The government's going to have to seriously invest in our farms. That's probably what's going to come out of it. So they don't have the opportunity to provide enrichment like straw because the sewage system gets blocked. So that's in the earlier stages. I'm kind of just predicting what we'll find there. But it is just good for saying, well, this is what the main problem is: capability, opportunity, motivation. Like for the One Well Pig project, I was doing qualitative analysis, and opportunity is just, it kind of shows you visually how big each issue is, and opportunity was a massive one and the other two were a lot smaller. So it is useful. It wasn't, I didn't know what was going to happen until I went through that process. So it is useful for just going in the right direction. So not creating an intervention just because you're like, oh, that kind of, that will probably work. And then you realize, well, actually, the intervention didn't suit what they needed, so what the people needed. So before I start getting you to do kind of designing an intervention yourself, I suppose I'll take any questions at this point. I know it's late in the day and I've given you loads of information, so I maybe break it up with a few questions, and then I might get people to go down to the tables at the bottom and in 2 or 3s to start working through the different steps. So you have your notebooks, you can maybe use those. So any questions before we get to the next part?